Hi, my name is Samara Mahindra and I am the founder and CEO of Carer. We are based in Bangalore. So, integrative oncology is, the use of non-clinical therapies along with conventional forms of treatment. What we're finding, or what I have noticed in integrative oncology, is that it's a well-established way of treatment and treatment protocol in the West, and top cancer hospitals or medical facilities around the world integrate the concept of lifestyle management and integrative oncology into their medical protocol. It's not yet established in India. It's a very, very new category that's coming in here to treat cancer care in India. However, there are a lot of doctors, a lot of hospitals, a lot of patients who are very curious about it and are slowly starting to inculcate forms of integrative oncology in the country. Memorial Sloan Kettering Cancer Center in New York City is one of the most renowned cancer hospitals in the world, have very strong integrative oncology units. MD Anderson has a very strong integrative medicine unit. And India, I am personally seeing a lot of doctors who are recommending patients to manage their nutrition, their physical rehab, their mental state of mind. So they are inculcating this in their treatment protocol. So that change is definitely happening. Oncology was treated through a very one-pronged approach. We have our conventional chemo, radiation, surgery, and then of course now we have immunotherapy and so on and so forth. However, the way that the industry, if I can call it, is moving is that we're looking at oncology through a very comprehensive, holistic manner. It's not about just treating the patient through allopathic medicine, which is compulsory and it is required, but there are many other elements to treating a patient as well, and that it doesn't work in a reductionist approach. We need to look at other elements to improve the patient and treatment outcome. So, example would be quality of life, example would be, the kind of nutrition that they are following, or the physical rehab, or managing their symptoms or pain, so on and so forth. Carer has been a very interesting, phenomenal journey. I've always been very interested in, healthcare and lifestyle. Never thought it would be oncology. Unfortunately, over 10 years ago, my mother was diagnosed with cancer, and although she had access to great medical treatment, there was a major gap that I noticed in the space of treating cancer and a patient and their family members. The area that we noticed was a miss is integrative oncology, and many years after that, unfortunately we lost her, but many years after that I went into training of integrative oncology and realized that India and countries like India don't have access to comprehensive, holistic, integrative oncology solutions. And that was the birth of Carer. And we are today now the first and only company offering integrative oncology solutions to cancer patients around the country. Very ironically, my journey started in Memorial Sloan Kettering. I had walked into their center soon as, right after my mother had passed away, unfortunately, from cancer. And I was exposed to integrative oncology then. I had the opportunity to meet the founder of the integrative oncology unit in Sloan. Her name is Dr. Barry Castellet. And she actually encouraged me to do something like this in India. With a lot of reluctance and apprehension, I decided to give it a shot, and hence Carer was born once I moved back and started integrative oncology for cancer patients over here. So when we started Carer, we did multiple patient studies and pilots and trials on different patient demographics and types of cancers, and we saw a tremendous improvement in over 50 parameters of quality of life for a patient going through treatment and post-treatment. So a lot of the time for Carer's journey was about testing our protocol on patients. Today, where we are is that we have built an end-to-end comprehensive protocol that is personalized and customized to each and every type of cancer and patient soon as they are diagnosed, and also post-treatment. What we focus predominantly on is clinical nutrition, physical rehab, and psychological intervention. We work very closely with the doctors and the hospitals in order to improve the quality of life of a patient. So the Carer protocol today, we have built our own methodology on the foundations of the three that I mentioned, which is food, body, and mind, and have seen tremendous amount of data in terms of the clinical improvements and the patient outcome. Carer impacts a patient in multiple ways. One is that we can look at the food. So we more or less personalize and customize the type of dietary requirements and nutritional requirements a patient requires on treatment and post-treatment. We do the same with our therapy called movement and meditation. This is an integration of yoga therapy and physiotherapy. It is a carer protocol, or it is a carer methodology that is built where we look at fatigue, pain management, lymphedema management, and all the physical side effects that can come about when a patient is going through treatment and post-treatment, so post-surgical rehab and so on and so forth. And the third element of what we offer is called mental well-being therapy, where we work with patients and their family members to help them accept the disease and motivate them to move on. So essentially, we work with the patient through food, body, and mind. But I tell my patients this all the time, that the idea of what we do is to empower a patient and their family members to take the therapies of what we are teaching them and then to make permanent lifestyle changes as they go along. So more than even the delivery of the therapies and having the patients more than the delivery of the therapies and having the patients involved in doing the therapies, we leave them with a wealth of knowledge and hopefully empowering them to make the right steps in terms of living a healthy lifestyle post. The carer protocol these are therapies that are delivered to the patient's home. So as soon as a patient is diagnosed, we are informed. We have tied up with more or less all the hospitals and doctors in the tier 1 cities in India. And we come on board as soon as a patient is diagnosed, and we deliver these therapies. We have specialized cancer care therapists who deliver these services to a patient at their home. We are monitoring the patient on an everyday basis. We send patient progress reports to their consultants as well as the patient for them to see how much they're improving as they go along the treatment. Carer essentially manages the side effects of the treatment, pain management, fatigue, quality of life, the immunity of a patient, and hopefully looks at decreasing chances of relapse. So we are an extension of the treatment of the doctor. So we are more or less their eyes and ears for their patient at home. So we are constantly in touch with the doctor. We work predominantly with the doctor in the hospital. We are managing all the non-clinical aspects of the patient while the doctor focuses on the medical aspect of his treatment. And sometimes there are patients who are not in a very good mental state of mind or need excessive amounts of counseling, or nutritionally they are deficient, or physically there is some constraints. So we focus on those elements to enhance the treatment effects for the doctor themselves. So we are partnered with doctors very, very closely in this procedure. The carer protocol has impacted about 400 to 500 patients so far, and over 1,000 including caregivers. We work with over 150 oncologists, and we have tied up with about 4 or 5 major hospitals in Bangalore and looking to expand into Bombay and Delhi. Some of the hospitals are Manipal, Aster CMI, and so on and so forth. Sure. So the carer team is built with a very strong operational focus, because a lot of our therapies are delivered at home. So we have a very strong team that supports that process. We are also building forth a research team, because majority, or if not everything, is based on data and patient progress. So that requires a very focused approach in terms of the kind of patient data that we are retrieving and how we can refine our therapies further to achieve more effective outcomes. We have a phenomenal team of actual therapists who are trained on ground. These guys come from a healthcare background and they are trained specifically in oncology. We have our own training methodology. So every clinical nutritionist who comes on board, or a yoga therapist or a counselor, is then trained under the carer protocol and then sent out to patients. And last, certainly not least, is quality. at the end of the day, we are delivering a service to a patient, and we need to see an improvement in all aspects of the parameters that we are measuring. And so quality becomes a significant aspect of our services, and hence we have a very strong quality team who focuses on the patient satisfaction, as well as is the patient improving medically and clinically. So interestingly, a lot of doctors and hospitals have reached out to us and said that, why don't you adapt the Carer protocol in neuro, cardiac, multiple different areas, even clinical obesity, so on and so forth. We have taken a stand to specialize in cancer because we do have a team which is very, very focused in oncology. It's such a big space. It's a rapidly growing disease, unfortunately. And a lot of patients feel like they don't have hope when they are diagnosed with cancer. And we want to bring back that healing and hope into their own hands and give them a chance to actually step out of this disease and probably live a healthier life than they did even before their diagnosis. That is not saying that we are only going to stick to oncology. There are so many avenues that we can look at, and we will definitely be moving into that as soon as we, really find and establish our space in oncology.